Izzy came to see us on the 1st of this month. She'd been boarded for like 2 weeks at a boarding place in Little Rock, and she was up to date on all her vaccines, up to date on all her preventatives, got a healthy checkup when we saw her in April. But when the owner got back, she noticed her and her other dog had lost some weight, were having runny stool and coughing. So we've seen her twice since she came in the 1st. We saw her on the 1st and the 4th, and she's back today with a pretty bad cough. I think we've cleared up the diarrhea situation, which is good. But antibiotics and then some stuff to kind of help dry up runny nose, thinking it was some sort of respiratory virus, doesn't seem to be helping her. So we're going to try to figure out why she's now developed a pretty bad cough. Could be, like I said, kennel cough, could be influenza, but she's had vaccinations recently for both of those. So hopefully we can figure out what's going on. It's okay. So,
I like Izzy.
yeah, she's sweet. I'm scared and I'm sick. Okay. You may want to. What a brave. Oh, she said, that's it. I'm done. You're alright. You're alright. You're a good girl. So brave. So brave. Oh, let's take one more. Perfect. All right, girlfriend. Not too bad. I see some little, I'll look at it closer. So, here's Izzy. She's on her right side laying down, and the x-ray is pointing straight through from left side to right side. And basically on x-ray, air is black and bone is like bright white, and all the muscle and tissue and everything is kind of in between. So here we have, of course, her spine here, and then her little ribs circling around here, and then her front legs kind of bending at that angle. And ideally here we wanted to take a picture of her thoracic cavity, which includes her heart and lungs. So looking at Izzy, it looks like, I'll zoom in a little, zoom in a little bit. It looks like she's got a little bit of fluid and inflammation, just based on kind of how this looks. Her heart's an appropriate size here, so it's not overly enlarged or anything like that. Her windpipe's kind of occluded here just by some fluid, it seems like, and a little bit of fluid kind of throughout here as well. The airways seem, so back here is kind of where we look at a lot for our lung pathology and stuff. Let me zoom in a bit more. So looking at it, so these structures are kind of normal. The way that the lungs work is there's airways, and then along those airways are blood vessels, and that's where oxygenation exchanges from the blood to the bronchioles. And you know, looking at enough normal, healthy lungs, it's easy to say that this is inflamed, but hard for people that, you know, don't look at it every day. So subjectively, there is a little bit of inflammation kind of around her little bronchioles in here. So I think we're dealing with like almost like a little bit of maybe a bronchopneumonia. Looking at, of course, x-rays always are like a picture, like a snapshot that's 2D. And we try to make this as 3D as we can. So we also take another image of her on her back. and here she is on her back. So the x-ray is pointing, shooting through her chest down to her back. And we get to see, by this view, we get to see her right lung and her left lung, and then kind of the shape of her heart. So I'll zoom in. And basically we can see here that, you know, I mean, there's a little bit of inflammation. I actually saw more on the side view, the lateral view that we took, more so than this ventral dorsal view. So that's good. She's got a little bit of heart enlargement right here. And she's got a little bit of a murmur, which I have to look back at her record, but I think that's pretty, I think she's had one for a while that we've been monitoring. So, yeah, I think she does have a touch of bronchopneumonia. Not sure if it's stemmed from bacterial or viral, but I'm going to talk to the owner about potentially doing that respiratory panel to kind of assess what's going on and what may have started it, and see, you know, if there's a certain bacteria that's in there that we need to treat with a certain antibiotic. So I'll talk with her about that.